Hello, I am Dr. Nagaraj Puttaswamy. I am a laparoscopic surgeon at Punya Hospitals, Bangalore. Any surgery for that matter has advantages and disadvantages. We have to take it that way. Anything in life, we do something, we have a lot of advantages on our end, and then parallelly we'll have to accept the disadvantages what comes as a package. But related to bariatric surgery, I can tell a morbidly obese individual will be suffering from multiple medical related problems and obesity related problems. So first and foremost, the advantage of bariatric surgery or advantage of obesity surgery is weight loss. Weight loss in the first 3 months is enormous and excellent, where the patient feels very light and he feels he can perform almost all the routine activities which he was not doing before surgery. And parallel to that, his blood sugars gets controlled very early after surgery. His hypertension becomes controlled very immediately, say maybe within a week's time after surgery, and his triglycerides, that is the lipid profile, becomes significantly better, and his hormonal imbalance becomes better. All this put together, he will be a transformed and a new individual following bariatric surgery. These are to be mentioned significant advantages related to bariatric surgery. So we don't try to suggest bariatric surgery for anybody who is borderline obese or say moderately obese. So first and foremost thing for any person who walks into my OPD is diet and exercise. That diet and exercise which doesn't give a solution to the person, only then if it's into a condition of undergoing morbid obesity surgery, and the advantages comes as a package along with the surgical procedure. So to mention few disadvantages, see, I've already told there are significant associated medical problems related to obesity. So for example, diabetes, heart related problems, hypertension. These are conditions which are very, very fragile on a patient who is morbidly obese. So we can expect medical related complications during and after surgery. This is bound to be there as a surgical procedure is done. Then post surgery, he may develop respiratory issues, difficulties, where we may have to keep the patient in the ICU for monitoring and treatment parallelly. And vascular problems like venous thrombosis are the common problems what we encounter following bariatric surgery. But fortunately, what we do is we don't take up the patient immediately after he walks into my OPD for a surgery tomorrow morning. We usually prepare the patient for close to 1 month before we plan for a surgery by advising medical management and diet management and all this, and we try to have a counseling and also the physician, the cardiologist, my pulmonologist, my dietitian, my physiotherapist, all are taken into confidence, and the patient is prepared for a bariatric surgery, and so that we can try to minimize the complications or disadvantages related to bariatric surgery.